Well, thanks again, Jason, to both you and Channel 14 for allowing me to come on and talk about COVID for a little bit. Well, I wish once again that I had good news, but unfortunately, we are really in the middle of a major spike here in this country. The last input that I heard on this particular claim was that every single state in the union is experiencing either an uptick or steady, no decreases in the entire 50 states, as of a couple days ago. The numbers here in Kenosha, we've now had 88 deaths, and we had 192 positive cases just in the last 24 hours from the latest reporting. In the statewide numbers, 16 people died yesterday, I believe, over the 24 hours from one of the reports. And I have to say that this is dead serious, as they say, and nationally 230,000 people have now died from COVID. So it's not getting any better. And meanwhile, we have, unfortunately, the president and still not taking the masking seriously as he should. And I'm sure that here in Kenosha tonight, he's here on a campaign stop. And I'm sure that there will be a lot of people that are not practicing social distancing and they're not wearing a mask. And it's the exact opposite thing that we need at this point in the trajectory of this pandemic that we are. We don't know if we're at the beginning or in the middle. We certainly know that we are not anywhere close to the end of. So I would just like to remind people that masks are known to be something that is effective. Wearing masks in public, certainly when you're around people who are not socially distancing, or whenever you're in a inside building. And of course, with the weather coming now, we don't have the opportunity that we had just a few weeks ago to be out as much as what we would like. So just make sure to put the mask on. It's a pretty easy thing to do in terms of knowing whether or not you are going to be passing it on to friends or family, to loved ones. This is easy stuff. Wash your hands, social distance, stay 6 feet apart. And the other thing is right now there's a lot of different opportunities for free flu shots, and everybody's advising people to go ahead and get their flu shots as soon as you possibly can. One of the dangers that we are in right now is this is kind of a high, busy season for hospitals, and because a lot of people are hospitalized with the flu, and when you combine that with the COVID, you want to make sure that hospitals are in good shape in terms of accepting patients. And so far, the headline today was that good news is that area hospitals still have plenty of capacity. So that's good news. There is some other local news. The mask ordinance is being debated at City Hall, whether or not to require mandate masks after the governor's mask order goes away. And also it has something about capacity at 50%. So, that is something that is on the horizon on City Council. In terms of the state legislature, I'm embarrassed to say that the legislature has not met for over 200 days, despite the fact that the governor has called special sessions. That we have encouraged the governor to, encouraged the Speaker, Assembly Speaker Robin Voss, to go ahead and to meet on COVID-related issues. And apparently there was a little bit of a rumble that may happen after the election, that there could be kind of a lame duck session. And I just hope that it's as soon as possible. And I hope that it's not something that we have to wait until January 4, when the new assembly is sworn in and we get back to business. But 200 days, that's just, nobody can quite understand how that is possible. And these are normally times that, people are running their elections and perhaps getting ready for legislation in the new legislative session. But these are not normal times. These are certainly anything but, and we should be meeting on issues that are important to people in terms of making sure that our schools are safe, and making sure that there are protocols where people feel comfortable with going back into restaurants and bars and retail stores. Right now there's not really any. People talk about the lack of business. Well, there's not really any shutdowns right now, but people are not going to out in the public much because there's not a trust that things are safe, and that's because, in my opinion, it's because of there are no protocols that have been researched and agreed to, and there certainly have been a lot of COVID reported in our public schools as well, and I think that will that they will continue to keep an eye on that, I would hope, and whether or not we are able to continue along the path that we're in is certainly questionable, I think. And of course, all over the country, there are spots that are experiencing shutdowns of restaurants and bars in particular. There's other countries that are experiencing at least 30-day shutdowns of both restaurants and bars completely in those countries. So, it seems to me that a mask ordinance is a long shot away from that. But so let's go ahead and give some of these initiatives an opportunity to work, and hopefully we do not get to anywhere near the numbers that people are predicting for by the end of the year or in January. That we anticipate, that they anticipate a lot more deaths. I would just like to leave everybody with a telephone number of my office. Once again, that is 608-266-0455. If you're experiencing problems with unemployment, or if you are experiencing problems with depression, alcohol or drug abuse, or domestic violence, all of these things have been kind of exacerbated as a result of the crisis that we're in, this pandemic that we find ourselves in. So don't hesitate to call my office, and we'll certainly do whatever we can to refer you to somebody that can give you some help, that can offer some assistance, and certainly we will do everything that we can to get your unemployment resolved. We know that people have long waits on this. It seems like it has gotten better in the last few weeks, but nevertheless, that there is still a lot of people waiting for the necessary help that they need. So, Jason, my feeling is that we probably will still have something to talk about next Monday. But in the meantime, I would just want to say that as representatives and as politicians, and we need to take these issues serious. In terms of really developing strategies. We know that schools, we would hope that their schools are safe, but you don't know whether or not their HVAC systems are robust enough to really be handling the number of air exchanges that are required to make the school safe. There are some worry that there will be a shortage of PPE as we go into this dark winter, as many are predicting. And, of course, there's kind of a war going on with President Trump and Anthony Fauci in the last few days. And, I just have to say that, that we are still really without a national plan on how to deal with COVID. And I think that the COVID task force is all but eliminated at this point. And I just think that is shameful. We are at the point now where we are approaching numbers where 4 times the number of Americans have died in this response as what died, and this is this is March, than what died in nearly 20 years of the war in Vietnam. So we need to, get serious about this and really come up with a plan to deal with it. So I'll leave you until next week. The dogs are getting kind of feisty. They think that they need to go outside and play, so I'm going to leave you Jason. I'd just like to encourage everybody that hasn't voted already, and certainly a lot of people have voted, let's get out and vote tomorrow. Jason, take Thank you very much. Thank you to Channel 14, and we'll talk to you next Monday.